Botulinum toxin has been used safely and effectively for the treatment and correction of aesthetic imperfections for several decades. At the same time, despite well-known dilution principles and injection techniques, new methods of using botulinum toxin continue to emerge. Current trends are focused on developing well-structured protocols for correcting expression lines to achieve pharmacological facial lifting. Taking into account the relationships between facial muscles and consciously managing their tone and activity allows us to achieve facial harmony and attractiveness, not only at rest, but also during facial expressions. Let's take a look at our model and determine the indications for botulinum correction. So, let's ask our model to frown. Perfect! Let's continue. It is absolutely clear that correction of the glabellar area is indicated because we can already see the formation of wrinkles and creases. And today, all our cosmetology and work is focused on preventive therapy. We are no longer talking about correcting age-related changes. We are now placing greater emphasis on preventive work, on preventing their development. Today, we have everything we need for this. So, correction of the glabellar are indications. Now, let's ask our patient to look surprised. It is also absolutely clear that creases are forming in the forehead area in response to facial movements, with rather active forehead muscles that lead to the formation of such wrinkles. And now, let's ask our patient to give us a beautiful smile. Let's also ask her to turn a little to the side, even brighter and more actively. Here, we can clearly see the formation of expression lines in the area of the orbicularis oculi muscle. These are the so-called crow's feet. Well, in most of our patients, starting from the age of 28 or 29, we already see this developing network of lines. Well, here it's a bit early to talk about developing excess skin in the upper eyelid area. However, the desire to strengthen the lateral edge of the eyebrow is usually present, and for most patients, this is identified as an aesthetic goal. And in order to lift the eyebrow and make the gaze more open, we will of course work right here in the tail part of the eyebrow, correcting the activity of the orbicularis oculi muscle. Let me remind you that the frontalis muscle is also responsible for active facial expressions and raising the eyebrows. But the major mistake specialists make is working only on correcting the frontalis muscle. Given the need to save money, many patients come in and say, please give me a reduced dosage, just 2 or 3 points, just so I can't do this. Let's ask the model to look surprised, so that these little wrinkles don't appear. However, when specialists or doctors usually start suggesting to our patients the mandatory correction of the glabellar area. Please frown. Patients say, well, I hardly have that kind of facial movement, I don't need it. So what happens? In response to correcting the activity of the forehead muscle, we get a compensatory increase in facial movement in the glabellar area. That is, on a completely relaxed forehead, we see an active crease forming in the glabellar region, and no matter what kind of lighting you're in, the ridge will always be visible. And this results in more active compensatory facial expressions in that area. What else can happen during the procedure is that patients also trying to accuse the doctor of attempting to impose additional injection points ask not to work on the area of the nasal muscle. Now wrinkle your nose, please. Bunny lines. Yes, right here in this area. As a rule, these wrinkles become more defined and pronounced as compensatory lines when we correct the expression lines that form around the orbicularis oculi muscle, but do not take into account the shift of compensatory movements and typically the development of these wrinkles in this area. Therefore, please be sure to draw your patient's attention to this correction. Bring them to the mirror and show them directly. Ask them to make facial movements, to wrinkle up, to make faces, and show the person that if these points are not fixed, even with such preventive doses, then over time on botulinum toxin lasts on average 5 to 6 months, which is quite a long time. If the facial expressions are shifted only to this area, even if there were no creases or wrinkles before, there is a high risk of them forming. So, how will the correction be performed for our particular patient? Now, taking into account everything mentioned above and the patient's wishes, we will plan the markings. All right, let's look surprised. Now, pay attention to this area as well. Our patient has already had botulinum correction done some time ago, and now it's time for a new treatment. This specific area right here, it's quite short indeed. So please, once again, look genuinely surprised. We simply cannot fully correct these particular creases here, because if we were to get too incredibly close to the very edge of the eyebrow, we would unfortunately end up with noticeable ptosis and a significant drooping effect, just like this. This is an undesirable complication, and no patient wants to put up with it. They always react quite strongly to such complications when they occur. That's why we never go very close to the outermost area. Our boundary point is about 1 to 1.5 centimeters. And even if there is still a little movement left in this area, it can be compensated by injecting into the tail area of the eyebrow. The orbicularis oculi muscle will gently lift the edge of the eyebrow like this, while we immobilize the frontal part. And this slight facial movement that will remain here will create a natural look. Nowadays, there is no longer a trend for a completely expressionless, immobilized face. Today, we work to preserve some partial facial movements in order to maintain a person's emotional individuality. People say, I want to look like myself, and looking like yourself is about your facial expressions. It's about the emotions that are reflected in these kinds of manifestations. So if we take a ruler now, here we have exactly 1.5 centimeters. Let's mark it. We also determine the center. All right. The central part accordingly, the correction will also be a preventive correction performed in the area of the nasalis muscle. About dosage distribution. How will I be distributing the units of the product in percentage terms today? Each of you works with your own product, and for each product there is a specific dilution chart and accordingly an injection technique with the appropriate number of units. I am providing a scheme that is adapted for use with any product. Thus, in order to reliably and effectively treat the globular area, I will allocate about 70% of the total dosage intended for the correction of the globular, and accordingly the frontal area to this zone. Therefore, 30% of the total dose intended for the upper third will go here. 30% of the total dose will be allocated here. Regarding working with the group of muscles around the eyes, specifically the orbicularis oculi muscle, here we meticulously use the full recommended dosage for treating wrinkles located above this particular line, and then carefully reduce it by precisely half when working with wrinkles that are situated below this same line. You will need to make this crucial adjustment depending on how significantly pronounced these specific wrinkles, particularly the crow's feet, are in your individual patient. Because sometimes this area is in good condition and this fixation alone is sufficient here. And here you will see this kind of radiating pattern which will need to be fixed. Accordingly, you will make these adjustments based on your patient. And now we move on to the practical part of our work. I'd like you to look surprised. Let's look even more surprised. And now we move on to correcting the glabellar area. Let's ask our patient to frown. 1 centimeter. Frown strongly. In total, Colleagues, I'd like to draw your attention to the injection technique. Each botulinum toxin preparation you work with has its own characteristics regarding the spread of the product around the injection site. So please pay attention to this, because these characteristics are what differentiate the products from one another. And for some products, the manufacturer highlights this as an advantage. What is a diffusion halo? It's the spread halo. The diffusion halo of each type A botulinum toxin preparation is different. The diffusion halo is the diameter to which the product spreads from the injection site. We use an insulin syringe graduated for 1 milliliter. This is the most convenient graduation. However, each manufacturer may provide you with a conversion for an insulin syringe with a different marking, with a different graduation. So, we inject to a depth of 3 to 4 millimeters. Usually you can feel when you are entering the muscle. That's enough. In other words, we should not hear a knock against the periosteum. We are working within the muscle structure. So, when should we expect to see results, the visual aesthetic result of our work? What should we tell our patient? The patient will notice the first reduction in facial movements around the 3rd or 4th day after the injection. How will this manifest? Our patient will look in the mirror, try to look surprised, but won't be able to. In other words, the facial muscles gradually begin to relax. And if everything goes well, a noticeable result will be visible within about a week. But we always invite our patient for a follow-up appointment for possible correction. We always reserve a few units. In each clinic, this request will be handled differently. For some, correction is already included in the initial cost of the procedure, while for others, correction is an additional charge. But in any case, we always keep this step available for the patient. This way, it's more reassuring for you, the clinic, and the patient. She always knows that everything is reversible and can be corrected. Thus, in about 2 weeks, we invite the patient for a follow-up examination. She should show us the results she has obtained, express her wishes, and if there is a need for correction, you perform it. When does the need for correction arise? If, for example, there is a partial asymmetry, which can especially happen when you are working with a patient for the first time. Now, let's ask our patient once again to show a surprised expression, which might, for example, be the case with our model. That is, immobilization has occurred, but in one specific area, the muscle movement is a bit more pronounced than on the symmetrical side of the forehead. And this bothers the patient. She says that every time she looks in the mirror, all she sees is this facial muscle activity. Please correct it. This is an acceptable correction. If a complication suddenly arises, for example, the patient says that she feels heaviness in this area, and you do not visually observe any prominent bulge, but the patient reports a feeling of heaviness. This heaviness is caused by muscle relaxation. The glabellar area is the corrugator muscle, which is quite heavy, and this sensation can occur, and it is normal. In this situation, you simply explain to the patient that this is an acceptable condition, and for a month we do not perform any correction here. We wait. It is possible that the patient will simply get used to this sensation, and then, after about a month, the product will settle well, microcirculation in this area will normalize, and this result will already satisfy our patient. So these are the recommendations you communicate to your patient. I remind you that it is mandatory to take photographs before performing the correction, including during facial movements. We ask the patient for permission to photograph her during active facial expressions, so that when the patient comes in for a follow-up appointment, possibly with complaints or requests, you can compare her current state with the original. What aftercare recommendations do we give the patient after the procedure? For the next 10 to 12 hours, we ask our patient not to lie down. In other words, she should remain active with expressive facial movements and stay awake and alert. Here's a little life hack for you. Try not to schedule procedures late in the evening, when it's already close to nighttime and it's obvious that the patient will likely go to bed in 3 or 4 hours. That's not ideal. We also ask our patients not to do any work that involves bending their head down after the procedure. This interferes with the diffusion of the product and its normal interaction with the receptors. Accordingly, sometimes patients ask, "Can I go to the gym after the procedure? I'll be really active there, with lots of facial movement and so on." And you should then clarify what exactly they mean by gym or fitness. If you're going to be lifting weights and lowering your head, then that kind of fitness isn't suitable for us, just like swimming pools, baths, and saunas are also not recommended on that day. So don't forget that we have initiated and worked with a breach in the integrity of the skin, which means these are entry points. That's why for 2 to 3 days after the procedure, we ask you to wipe your face with a solution of chlorhexidine, miramistine, or another antiseptic. It's also best to avoid public baths, saunas, swimming pools, and to refrain from consuming alcoholic beverages for 2 to 3 days, as well as not to take B vitamins for at least 1 month after the procedure. Why is that? Let me remind you that B vitamins improve neuromuscular conductivity. That's exactly the area we've just worked on. We've interrupted the conductivity between the nerve fiber and the muscle. And if you didn't ask and the patient didn't mention it, and for example, she's taking some kind of multivitamin complex with B vitamins and continues to take it, then it's possible that the effect of the botulinum correction will be barely noticeable or might not occur at all. That's why, when taking the patient's history and working with her, always make sure to clarify this. And if the patient is taking such vitamins, unless it's for specific medical reasons, we ask her to stop taking them for a while. We also clarify that if in the near future the patient falls ill and the doctor prescribes antibiotics, she should come in and let us know exactly which antibacterial medications were prescribed. Because a number of antibacterial drugs destroy botulinum toxin, and in that case, its effect will stop. It's important to inform your cosmetologist about this to avoid any misunderstandings later, such as thinking the product's effect was too short-lived. These are the simple recommendations we give to our patients. We make sure to record all details regarding medication intake and lifestyle in the patient's file, and we take photographs. And with that, we let our patient go.